Good morning. It is a beautiful Tuesday morning in November, the week after the election. For those of you who don't know me, I wanted to introduce myself. My name is Dan. I recently graduated Nurse Practitioner School, and I am going to be taking the boards in 3 days. It's been a whirlwind preparing. I feel like I've devoted a tremendous amount of time over the past 2 months, specifically over the past month, specifically over the past few weeks. I feel nervous, anxious, excited, really all of the above. But I figured a good way to prepare for this would be to pass on the information, as I always say, learn one, teach one, do one, or something like that. So I can't do yet because I'm not yet licensed by the board, but I can teach, so that's what I'm going to do. There's a total of 20 modules that I will be gradually working my way through, beginning with pulmonary, then we're going to go on to hematology, review neurology, then antibiotics fourth. Fifth is going to be mental health and primary care. What are common disorders that we see? What are the management? How do we screen? Number 6 is going to be GI. The GI system is really big, and it's different pathologies with kids versus adults. We're going to talk about GERD. We're going to talk about colon cancer screening. We're going to talk about promoting colorectal health, signs and symptoms of acute cholecystitis, liver markers, reading hepatitis panels A and B. And then we are going to move on after GI to GU, the urinary system. We're going to cover UTIs, both in women and men. Women, basically, if they're like adult and healthy, it would be considered a uncomplicated UTI if they're not recurring. If they are recurring, or if they're male or pregnant or younger, it would be considered a complicated UTI. We have different guidelines for each of them. After that, we're going to talk briefly about exam strategies. We're going to go on to cardiac, cover hypertension, hyperlipidemia, heart failure, signs and systems, workup, management, and then we're going to conclude cardiac with murmurs. After that, we're going to move on to orthopedics, talk about systemic, like inflammation. We're going to talk about like osteoarthritis, rheumatoid arthritis, fibromyalgia, and we're going to go through the body from head to toe, talking about the various orthopedic conditions that you can see with the shoulder, the elbow, the wrist, such as carpal tunnels of the wrist, lateral and medial epicondylitis with the elbow, rotator cuff tear, or impinged nerve in the shoulder, pathologies with the hip, the knees, meniscal tears, ACL tears, MCL tears. What are some of the common findings? What are tests that we can use to work those up? After that, we are going to go on to endocrinology. We're going to go through diabetes, type 1 and type 2. What are the difference between type 1 and type 2? What are the similarities? What are some of the medications that we would use for type 2? As a lot of you are probably aware, during the past few years, GLP-1 targeting medications have become very popular, like semaglutide, Wegovy. So we're going to talk about weight management, hyperlipidemia, metabolic syndrome. We're going to talk about thyroid disorders briefly, primarily hypo and hyperthyroidism, differentiating between primary hypothyroidism, secondary, and subclinical. After that, we are going to go on to men's health, deal with a bunch of issues regarding erectile dysfunction, hernias, epididymitis, and how to differentiate that between that and testicular torsion. We're going to talk about the role of the Pren sign, the cremasteric reflex, and findings, and then what should you do. Testicular torsion is a surgical emergency and would need to be referred to urology. Next, we're going to go on to women's health. We are going to cover a number of issues regarding breast health, screening for breast cancer, recommendations when they start. We're going to talk a little bit about the female reproductive system and urinary system and bacterial vaginosis. We're not really going to talk too much about STIs in too much detail in this section because they will be covered in section 17, devoted entirely to STIs. After that, we have dermatology. Derm can be tough because it's very vague. Rashes or skin conditions can be caused by many different reasons. Some are like related to contact exposure or something specifically touching the skin, and sometimes there's systemic skin manifestations of systemic conditions. So we'll go through all of that. We'll talk about the skin, screening for various types of cancers, the three primary: basal cell carcinoma, squamous cell carcinoma, melanoma. Those are the big three. We're going to talk about actinic keratosis. We're going to talk about like the terminology, which is not necessarily a strong point for me, but it's definitely worth reviewing in preparation for the boards. After derm, we're going to go on to EENT, and we are going to work through that, talk about some of the common pathologies: strep throat, otitis medius, the ear, differentiating between conductive and sensory neural hearing loss. We're going to talk about conditions related to the eye, blepharitis, keratitis, chalazion, sty, strabismus, when vision screening starts. I mean, there's a ton to do with the eyes, and when you are diabetic or you have hypertension, you're at increased risk for various pathologies related to the eyes because of the microvasculature. After that, we are going to and we'll also talk about rhinosinusitis, acute otitis media, strep throat, the common regimens for pediatrics and for adults. After that, we're going to go on to pregnancy, talk briefly about a lot of things. What is the role of the primary care nurse practitioner or the family nurse practitioner in managing pregnancy? We're going to talk about signs of pregnancy, presumptive versus probable versus objective. We are going to talk about like the normal course, 40 weeks, the 3 trimesters. We're going to talk about medications that aren't safe for pregnancy, and then like how you would treat pregnant patients, because as I'm sure all of you know, many medications are not considered safe to take when you're pregnant. And we're going to talk about a few conditions that you need to be able to look for, diagnose, recommendations in terms of supplements, the role of folic acid, what it does, preeclampsia, eclampsia, What else for pregnancy? I can't think of anything else. Next, chapter 17 is going to be STIs. We're going to talk about HPV, HIV, gonorrhea, chlamydia, PID, pelvic inflammatory disease. We are going to talk about bacterial vaginosis, the workup, the treatments, first lines, etc. After that, we're going to go on to pediatrics. We're going to talk about immunizations first, and then talk about common pediatric conditions, working like our way from head to toe. So this is a pretty long section. After that, we're going to talk briefly about pediatric growth and development, various milestones, what we need to look out for as NPs, and crucially, we just need to be very cognizant about tracking growth and development appropriately throughout pediatrics. We're going to talk about the anticipatory guidance that we're supposed to provide to patients and their families, and then we're going to finish off with the sports pre-participation physical. After that, the final module is caring for the older adult. Like adults go through a number of physiologic changes, and as a result, they are more vulnerable to a lot of things, be it polypharmacy, falls from frailty, falls from polypharmacy, potential elder abuse, and then the way that the body metabolizes medications changes as we age. So we're going to talk a little bit about that. We're going to talk about capacity, how we assess it, and if a patient does not have capacity to make medical decisions of their own, what to do. We're going to talk about various terminology, living will, pulsed, DNRs, etc. And then a final chapter, I think that if I have time, I'm going to really try to tie it all together, talking about memory techniques for remembering stuff like creating a mind map, incorporating mnemonics, spaced repetition, just various strategies that I'm going to try to incorporate here and there, because a lot of time I feel like traditional schools do a great job of teaching you what to learn, but not necessarily how to learn it. That's always been an issue, and I hope to address that a little bit, because the mind and memory are very powerful things, and there are certain tricks and techniques that can really help remembering things, to make remembering things a bit easier. So we are 3 days and almost 8 o'clock, 6 hours. So we are 78 hours away from exam time, Friday, 2 p.m. This is the home stretch. I'm feeling cautiously confident, but I definitely think that this will help me really solidify the material in my head, and I plan to put this out on YouTube, so hopefully others can find this and enjoy, hopefully learn a little something. And yeah, this is my intro to Family Nurse Practitioner board studying. So let's get it. I hope everyone has a good day, and I will see you all shortly.